Hi, it's nice to meet you. My name is Felicity. Looks like you're my first test subject. Oh, don't look so worried. I'm very knowledgeable in my field, okay? So, you're coming in to have your eyes checked, I believe. Your first appointment? Okay. And I have written here in the long run, we're going to be changing your eyes. Okay. Well, I chose you because you have total color blindness, and I've never known anybody who had that before, so I'm really excited. So, how long have you been seeing black and white? Okay. Okay, so since birth? It's so fascinating. Okay. Don't worry about what's going to happen next. Your health and safety is absolute paramount to us. During the surgery, you're either going to die or become blind, so it's not too bad, right? Okay. Well, I can answer some more questions soon. I do want to do a eye examination today, and then we can book for your surgery. Okay. So what I need you to do is I need you to tell me your date of birth. Okay. And what day it is. And I just want to know from a psychological point of view why you want to have two new eyes apart from the obvious. Oh, it is because of the obvious. Okay. Right. Okay, well, that's all that I really need to know. So let's get started, right? It's not gonna hurt. This is just like totally going to your normal optician, you know? Okay. Right. Well, if you have any questions, just let me know, okay? Okay, so what I need to do is I want you to look straight at me. Okay, I'm just gonna come a little bit closer and just have a look at your eyes, both of them. Do you find that one is blurrier than the other, or both are blurry, or anything like that? No? Okay. And I'm just gonna touch here if you don't mind. Okay. Right. Do you get any soreness? Do you find that they're sore or itchy or inflamed? Okay. And just to the other side, I'm just gonna have a look. Let's have a look here. Okay. Well, they look normal. Okay. And you haven't had any infections or anything in your life? Okay. And where did you get that? Okay, from a family member? And do you remember when that happened? Okay. So was it sort of like gooey crustacean? You couldn't open your eyes properly, especially in the morning? Yeah. So, it sounds like you had conjunctivitis, so. Right. Okay. So, now that I've had a look at your eyes visually, I just need to measure them because if we are going to cut out your eyes, I need to make sure that we get the right mold to actually shape the new eyeballs, okay? So if you can just look straight ahead for me, I'm just going to measure from one side to the other. Okay. Good. And just up at the top here. Awesome. Adjust your eyes themselves. So, okay. And just the other one. Right. There's a little tiny bit of a difference in centimeters, like 2 centimeter difference, but it's fine. We aren't all symmetrical, of course. So we've got 10 inch over 120 inch, 13 on the scroll, 11 on the ovoid. Okay, so next I'm going to shine a light in your eye, okay? So if you just keep looking straight ahead or look back at the wall. So I'm just doing a swinging flashlight test, so we're just going to go in and out, okay? So, in, out, again in, and then out, in, and out. So I'm really looking at your pupils here and how they dilate. And just on the other side, out, again in and out, in and out, and I'm just going to spread it all across here. Okay, so keep looking straight ahead. You're doing a really good job. Okay, perfect, great, thank you. You might want to flutter your eyes for a second. You might be seeing some black dots. Okay, so I want you to look back at maybe just the plant in the back, and then when I tell you to switch focus, I'd like you to look at my finger, okay? So if you just look at the plant and switch focus. And back at the plant now. And switch focus. Okay, good. And just again, look at the back. And now look at my finger. Great. And I'm just going to slowly move it in, so if you just keep staring for me. Back out and back in. Okay, perfect. Thank you. So that all looks normal. Next, I have some colorblind tests. So I'm going to see if you can see any of the numbers on here. So I'll start off by this one here. Can you see that? You can't? Not even the numbers? Complete, can't see any colors. Okay. What about the bottom one? Can you see that here? Okay, same, right? I mean, I can see it so well. I mean, I don't want to upset you, but when you get your new eyes, you're going to see a whole variety of, it's just magical. I just want to try one more though. It's a little bit darker, so How about this one? Nothing at all. Not even yellow or blue or pink? No numbers? Okay. Well, it says number 5. Okay. Thank you. So that is very interesting. I'm just amazed by your eyes. They're so unique. So your operation's probably going to take about 10 hours to do. It just depends how you go with the drugs, things like that. Which I should probably ask you, have you been under at all? You have? Okay, that's good. You didn't have any complications? Great. That's just something for me to note down just in case, because I wouldn't want something going wrong whilst I'm doing my work. Okay, so a bit easier now. I have an eye chart or a Snellen chart. And I just want you to read the top to the bottom as much as you can go. Okay, so just right at the top here. Right, good. That's correct. Okay, and I'm going to get you to stop now, right? And I want you to cover up one of your eyes and then keep going. And we're probably just going to stop around here, if you can do that for me. Great. All right, and just switch to the other eye now and see if you can go a little bit lower. Okay. Great. Perfect. Thank you. So you seem to be able to read words very clearly. Or letters, sorry. Perfect. Okay, so, I mean, it looks like we might just have to put color lens on you, right? Okay, so it might just mean that I have to take your eyeballs out as normal, and then put like a color film on top instead of, I don't know if you've heard of the people that are partially colorblind and they can get these glasses and they just see all of these colors. You haven't seen that? Oh, you absolutely should. It's great. It'll kind of be like that for you, except even better because you can't see any color at all. It's quite exciting. No, I haven't performed it on anybody else, but I am knowledgeable in doing it. I kind of just done it on robots and things like that, and they came out fine. Some didn't, but that was a very long time ago, so you should be relatively fine. It takes about a month to recover, so you'll have to be covered up till then because you're going to be sensitive to light, but I'm pretty sure it's going to be extremely worth it for you. Okay, so I'm going to have a little feel around your eyes now. So I just need to pop on my trusty gloves. And you're not allergic to latex or anything like that, because the last thing I want to give you before your surgery is an infection or a rash or something like that. Okay, so what I want to do is I want to just come a little bit closer and just pat around your eyes and see how firm it is. Okay? So I'm coming in closer and I'm just palpating. And it does feel nice and soft, plumpy underneath. Do you sleep well? Okay, 7 to 8 hours is pretty good. It's just like me. I'd sleep in for longer, but you know, life. I've got to work. Okay, so petting around, and I'm just gonna hold down your eyelid. Okay. All right. So, can you just look up straight to the ceiling? Okay. Good. And just on the other eye, just look straight up for me. Okay. Good. I'm just going to get my other light now, and we're just going to do that again, but I'm going to get you to go into different directions, okay? So, be a little bit bright, you should be fine. Okay, so if you can look up at the ceiling again for me. Okay, and look down. Okay, good. And look to the side and to the other side. Okay, good. And if you can just follow in the direction that my pen is going. Okay. And keep following. And then straight back in again. Just looking at both of your eyes now. Right. Okay. And just on the other eye, get you to pull this down here. And I want you to look down for me this time. So down. And if you just look to the side. And the other side. Okay. Good, and look up. Great. And again, I'm just gonna go look at both of your eyes now. The pupil dilation, consensual, sensual. That looks pretty good. And just follow the light out and follow the light in. Perfect. Thank you. And I'm just going to have a deeper look at your eye. I want to look at your optic nerve, your retina and your lens, and the macular. So I'm just going to use this little tool here. So it's a bit of light again. Okay. But this lets me have a really good look inside. Okay, so I'm just going to go here first. Okay, so just look straight ahead. Okay, and if you can just blink for me. Great. And again, blink for me. Right, great. Okay, so I'm going to come in a little bit closer now, okay? And I'm going to look right inside your eye. So I have a little magnifying glass that'll allow me to have a look inside. Okay, so alright. So just keep looking straight. I can see inside your eye. It looks so fascinating. You have no idea. You really are missing out. Oh, I can see an issue there. Okay. Looks like there's a little bit of nerve damage, which is odd because there's no delay in your responses and your pupil dilation is good. So, that's interesting. Alright. Okay. And I'm just going to have a look on the other side. So you can blink a couple of times. And I'm going to come in close. And alright. So focusing in there, I can see the optic nerve. And there's a little bit of nerve damage, but it's nothing serious. Okay. Keep looking. Okay, just gonna have a look up. Right. And look it down. Okay. Alright, so I'm getting into just a little bit further in here now. So just getting really in there and looking around for any damage, vessels, nerve endings. Okay. Okay, so that's looking good. And I just want you just to look up for me again, okay? Okay. Right. Okay. And the other side. Okay, just wanna. Okay, just having a look here. Right. Okay. Okay, good. Right. Well, that was very interesting. Okay. So, let's look at your next appointment, shall we? So your second appointment is essentially going to be the surgery. This is just pre-surgery. This is getting you all prepped and ready. I'll be with my associate as well, and I'll be able to go through a couple of things a little bit more deeply within your eye and what we're going to do. Okay. So I'm sure that you've read about our facilities online. We're very safe. Very. And what I need you to do is, as you'd probably know, is you need to just sign this waiver, okay? And it's a bit like when you do go to hospital and have operations. You're either may suffer from total blindness, or die, or you're going to be totally fine. So if you would just like to sign your life away, okay? Oh, and if you just initial and put in your full name as well, that would be great. Thanks. Okay, perfect. Right, thank you. I'll just make sure that's all correct. Okay. So I have your measurements, I have everything here, your pupil size, and what we need for the mold in order to get that along the way. Okay, so I will see you in 2 weeks, okay? So 2 weeks, and you'll be able to see, hopefully. Okay? Great. I'll see you then.